Hello and welcome to this edition of Healthy Living. I'm your host, Frank Poulin. We're here today with Acting Director of the Western Tidewater Health District, Dr. Nancy Welch. Hello, Doctor. How are you?
Good to be here.
Now, today we're going to talk about, of course, it's flu season.
Oh, yeah.
And that's the big topic on everyone's mind.
Yes.
Because we're kind of in the thick of it now, correct?
Oh, we're very much in the thick of it. When you look at the graph has gone up. Now, that's not unexpected, though, let me say that. We're pretty consistent with where we were last year. We expect January and February to be our really big seasons. The thing about this season is it's primarily H1N1.
Okay.
People may remember that as the swine flu.
It was big in 2009, right?
Yes,
yeah.
Correct. And this is, again, the H1N1. The importance of that is that the H1N1 primarily affects the younger population, not so much the over 65, but it's affecting the younger population. They're very young, or the young adults. And so they're the ones who are becoming more ill with it.
Huh.
So as
Are
far
there
as
any trends to determine why that is?
Oh, no. This flu virus is smarter than we are.
Okay.
So it's the valedictorian of the class. So it's way ahead of us. But the good news is that the people who developed the vaccine were also at the head of the class because they include it in the vaccine.
Okay.
So the vaccine is very effective against the H1N1 as well.
Now, how soon should you get vaccinated to protect against the flu virus?
Well, we got our vaccines, my children and myself, in October.
Okay.
But you can still get it now because we are on the surge. The only caveat that you have to understand is that it takes about 2 weeks for your body to develop the protective response to the vaccine.
Okay.
So if you already have the virus in your system, you've already been exposed, you already have the virus in your system, then you can still get sick from it within that 2-week period.
Okay.
Because
so you're not totally immune once you take it.
You will be immune once the protection develops, but it takes 2 weeks to develop. So in that hiatus, while your body is revving up and developing your natural antibodies, if that virus is already sitting in your system because it has a short incubation period, meaning 1 or 2 days, you're exposed, in 2 days you get sick. That's obviously in less than a 2-week period where your body is building up its protection. So if you already have the virus in your system, or you're even exposed during that 2-week period, then yes, you will probably have a good chance of getting the flu. It won't be because of the shot. Many times people will say, oh, I got sick because I took the shot. The flu shot has killed germ in it, dead, cannot cause disease. But it is because of that 2-week period it takes for your body to build up protection. Even if you get the disease, though, in that because you already have the germ in your system, having had the vaccine, in most cases, will make it so that you're not as sick as you would have been otherwise. Right. So that certainly helps. And anyone who's had the flu appreciates not being as sick.
Sure. Now, how would you go about, say you're just starting to feel ill? How do you know whether or not it's going to be the flu?
Well, you certainly don't know to begin with, but the symptoms of flu are high fever, your body just aches, you have trouble moving, you just don't want to do anything, you're in bed, you're not hungry, you may have respiratory symptoms. And once we know the flu is in the community, as we do now, then doctors pretty much make the diagnosis based on the symptoms. We don't need to do much more testing, although if you come into the office or do a rapid flu test kind of thing, but a lot of times they don't want you to necessarily come into the office because if you call them within the first, say, 24 hours, they can actually prescribe medicine for you.
Over the phone?
Right, that you could get at the pharmacy that would then, again, help lessen the length of the disease.
Okay, the disease will still take its course, it'll just be a lesser strain.
Be much shorter, and of course, the problem now is you go to a doctor's office, even if you don't have the flu, you might be exposed to people who have it.
Just in the waiting room.
Right, or if you have the flu, you may expose other people. So that's why doctors in many cases prefer that you call so that they can give you recommendations over the phone.
Now they're also using masks nowadays, right?
In the hospitals?
Yeah.
Yes, and the mask, I have to say that the evidence is not there one way or the other.
Really?
Nobody's done the research on it. However, there's ample information to indicate it certainly creates awareness. You're sitting here, you're aware of it. When you think of the mask, you think, flu, I want to protect myself. So there's no doubt that having the mask creates a greater awareness so that individuals will be more cautious, whether it be wearing the mask or just, flu is here, I need to wash my hands.
Okay. Now, even if, say, I got the shot, does that guarantee that I won't get the flu?
Oh, don't we wish anything in life was a guarantee? If you know something is a guarantee, please tell me. I haven't found it yet. But the flu shot is very effective. It's 85% effective. And I know some people say, oh, well, I'm going to depend on everyone else getting the shot so that I don't get the flu. But when I look at odds, we all live in basically Las Vegas. Every day we wake up, we're in a Las Vegas world. We're making choices based on odds. And quite frankly, I think 85% protection is better than 0% protection. So I always go with the shot because 85% is so much better. It's not 100%, I agree, but it's a whole lot better than 0.
Okay. Now what other precautions can you take not to get the flu virus?
A lot of other precautions. And the simplest and easiest one, which so often is so simple that people just discount it, your mother, your grandmother, everybody told you, wash your hands. And that truly is the most important thing to do.
Is it really?
Because what happens is people may have the flu virus, you don't realize how many times in a day you might wipe your nose, scratch your nose, and so you have the flu virus on your hands.
Doorknobs.
And you're right, you're doing the phone, you're doing the doorknobs, I'm handing you a pencil. So there are different ways that germ can then be transmitted. So the key is to just be very, very diligent and attentive to washing your hands often.
Okay.
Very often. I have one of those huge hand sanitizer bottles on my desk in my other office, and I just use, well, actually I have one here too, and I just use it often.
Just throughout the day, just
yes,
make sure you're getting rid of any viruses, so bacteria.
Right, so that you can get rid of it. The other thing is, it used to be that we were told to cough into a Kleenex or something.
Yeah.
We don't want to do that because what happens in most cases, people cough into a Kleenex. Women have a tendency to stuff it up a sleeve or they stuff it in a pocket, which means they're reusing it, and so that germ is sitting right there.
Yeah.
And so they just continuously then have it on their hands and again can expose it to people. So the new technique that's been around for several years is if you cough, you do like this. It's called the...
Into your elbow?
Into your elbow or your shoulder. And you know what? The children have gotten much better at that than the adults because old habits die hard. But by doing that, you're protecting it from spreading the germ, because it's airborne, goes out into the air. So you're protecting it from doing that, and you're also keeping it from getting on your hands where you might spread it to other people. So if you are sick, you want to cough like that so that you're not spreading it to other people, and you want to not go to work.
Okay.
Some of us are too much workaholics, and so we're coughing and we're sneezing and we're dripping and we're sick, but we go to work anyway.
A lot of people say I'd rather be at work on a sick day
we're going
take
to work
one later. Yeah.
Right. But the problem is your colleagues don't like that.
True.
Because you're going to be spreading it to your colleagues.
Yeah.
And so we really have done a big push for businesses to be sure that they provide good sick leave so people can go home. Another very simple, easy thing, I go to the grocery store, you push the carts in the wintertime, and most grocery stores now have hand wipes.
I've seen that, yeah.
Yes, and I always wipe the handle of the grocery cart because you don't know who had it before you.
Absolutely.
And it's a simple,
Might have been
easy
there buying
thing to
soup
do.
for their illness.
That's right, exactly, exactly, chicken soup.
Yeah.
So it's very good to wipe it.
Okay. Now, what are some other strains of the flu that maybe the public isn't aware of as much? Because the flu is the one that gets all the good press.
Well, the flu is a generic term, and there are actually multiple different kinds of flu. Sort of think of it like based on their genetic structure. Think of it like that. I mentioned H1N1, but there's H5, which is where people have heard of the avian flu, and that's an H5. This H5, this H and N are sort of the nomenclature that gives designations as to kind of like the species of the flu, the subtype of the flu. But the ones that are in the vaccine, they decide from the previous year based on which ones were prominent.
Okay.
And they hit it right on this year.
Did they?
in terms of the ones that are prominent in the community. So the flu vaccine this year is very good.
Okay. Now, the other buzz disease we hear about, I guess, is the norovirus. That's been getting a lot of play.
Yeah.
Now what kind of symptoms does that entail, and how can you prevent that one from happening?
Oh, it's no fun either. And it's very, very contagious, easily spread. The norovirus is gastrointestinal. And some people historically might have said, well, I have the stomach flu. Well, it's not really flu.
Okay.
Like flu is really respiratory, but that's what people used to call it before we actually had the test where we could determine the bug.
Okay.
And the norovirus causes vomiting, diarrhea, cramping. You get it exhausts you.
Okay.
Generally, you're very sick for a couple of days, and it takes a couple of days to recover just because you're exhausted from the whole episode. And it's highly contagious. We are seeing that in the community. We're seeing it we've seen it in some schools, we've seen it in some residential living facilities, congregate living facilities, because they're closer together and therefore it's easy for it to be spread.
Sharing more stuff.
Yes. So again, a key for preventing that is washing hands. Washing hands. Norovirus can also be spread by way of foods. So we especially want to be sure that food handlers, whether you're at home or at a restaurant, that you're washing your hands carefully and that you're sure that your foods are being prepared at the right temperatures.
Okay.
So that they can kill the virus and not transmit it. And on both of these illnesses, they both are viruses, they're not bacteria. On both of these illnesses, you want to be sure and drink lots of fluids.
Okay.
Because you can get dehydrated just because you just don't want to move. You just want to just lie in bed and not move. And then with norovirus, because you may have vomiting and diarrhea, you're getting rid of fluids.
Yeah.
So solid foods aren't anywhere near as important as the liquids, so
Just
you don't
getting
get
the fluid in you
dehydrated.
constantly. Now, what is the length typically of flu season?
Well, if the length generally, it depends from year to year, but we start thinking about it in October.
Okay.
We've had some times where we get some occurring in September, but generally we think of the flu season beginning in October, November, and then lasting through March or April.
Oh, that long?
Most of the time, our peaks have been in January, February. Sometimes we've had a peak in November, then it goes down, and then it peaks again in April.
Okay.
So that's
just
kind of
because people are
unpredictable.
Congregating for the holidays, or is that the...
Well, certainly that
Helps.
increases the chance, right, exactly. That increases the chance because everybody's together, they're in closer contact, and it's the same with schools. And one of the ways that we judge it and we're able to sort of predict when it's going is we have an ability to look at the emergency room visits.
Okay.
And they're classified by syndrome, meaning respiratory, gastrointestinal, something like that. And so we get that information and graph it out on a daily basis of what's coming into the emergency rooms, and we know what to expect, what's normal from previous years for that time of year. And so we can see as it rises. So we knew ahead of time when the flu season was coming because we could see the trend going up and going beyond what we would expect. So, and we are also, our eyes and ears of the community are the schools.
Okay.
The schools are huge eyes and ears of the community. They let us know when they're having increased absenteeism in the cause, and that tells us. And we've had both flu and norovirus in school systems, and when that happens, the schools are very good about involving us, and we work with them on being sure things are cleaned properly so it's safe for the children.
Okay. Now, are there any, I guess what would you call it, mutations of the flu strain that are appearing, or?
Well, it's an interesting question you ask that. The H1N1 is kind of a mutated strain called PH1N1, which is a little new kind of a mutation. I don't know the major significance of it necessarily because we are still seeing with that one that it is primarily attacking the younger ages, as I said. And in fact, it's the younger ages that are tending to get sicker. So people who have been in the hospital, you may have heard North Carolina's had quite a problem, and they've had several deaths. Those individuals were primarily less than 65.
Oh, wow.
As opposed to the usual flu season when we might have another kind of a a flu type A flu, which then you will see more of the over 65 who are sick and hospitalized. But this year we're seeing, primarily because it's H1N1 in this P variant, that it's less than the 65-year-old.
Oh, wow. And how does like weather play into something like this?
Good question. A lot of, there's, we grew up saying don't leave the window open, the cold air, I don't know if you did, but I did. The cold air blow on you and give you disease. Well, cold air doesn't give you disease.
Okay.
The germ gives you disease.
Okay.
But the germ does thrive better in cold air.
Okay.
So when it's cold season, we see that. And there are some ramifications of being in that cold breeze, in that we know that the cold does two things. One, it kind of reduces the movement of your cilia in your respiratory system. We have like little hairs in our nose and all the way down in our lung. And its purpose is to sort of be like a broom to sweep the germ out. And when it's very cold, those cilia don't function as well. So it's not as effective at sort of sweeping the germ out. And also we know that cold, very cold, can be stressful to your system. And stress on our bodies does reduce our immune ability.
Okay.
It makes us more vulnerable to illness. So it's not the cold breeze per se that's giving you the illness, but it's not a total myth, because there are some impacts from that cold.
Okay. What other general advice would you give the public on trying to stay away from the flu, or if they get it, what to do?
Well, the obvious is you want to be extra cautious if you're in large gatherings, because that's the other thing about the winter, is it's cold, so inside, which means we have larger congregations of people inside. So on those events, whether you're home with a big family gathering or you're home watching movies, you want to be sure to really pay extra attention to washing your hands and to doing the cough so it's not spreading.
If you see the person with the tissues, walk away.
Walk away. Don't ask if you can borrow it. So, because that really, it just has germs all over it. So you don't want to do that. And the other thing, and this sounds so basic, again, it's like the basic hand washing, but truly getting enough sleep and eating healthfully is good, because both of those help feed your immune system, if you will. And we want our immune system to be as healthy as it can be, because our immune system is pretty much our army against disease. And if we deplete our army because we don't get enough sleep or we don't eat right, then we're going to be struggling to protect ourselves against the germs.
Cheese balls and hot dogs are not going to help.
No, I'm sorry, except that, if you go to baseball games, you can get hot dogs. That's good.
Make sure you get your vegetables earlier.
Right.
Now, if the public has any questions or anything like that, can they reach your office? Or?
Oh, absolutely. They can. Actually, an easy way to reach me, because by my phone, Android, I have access to email, and I'm very compulsive about responding to emails. So I welcome the public to contact me, and that's nancy.welch@VDH, like Virginia Department of Health, .Virginia, spelled out, .gov. And I encourage people to contact me. I always do respond.
All right, great. Well, thank you so much for joining us, Dr. Welch,
Thank
today.
you very much.
And you heard it here, tips on how to prevent the flu, and if you do get the flu, tips on how to shorten its lifespan. Thanks for joining us. This was this edition of Healthy Living. Here's to your health.